they don't have time to digest stuff and really think about it. So
Yeah, that's just, it's such, that little Traverse Bay is beautiful up there, and it's not so
yeah,
packed, I mean, it's.
and then you can put
tourist laden to a
anything on
degree,
there
but not
and make it
packed
look
out.
any way you want it to. So it's
And,
The Michigan
Journalism-
is great. I would say it's like going to the ocean and
It is.
being
to be
Yeah.
to be an
that
honest
that
journalist
rising,
is a tough.
lake water is
I
an
think-
issue.
I'm not so much. Well, I'm not. It's tough on your level too, but
Brad, I
on
hear
that
you're there.
national level,
yes.
Joe.
the pressure's got to be
Hey,
unbelievable that you got to
10:30,
produce.
why don't we get
you know?
started?
Yeah, you've
I'd
got
like
to
to welcome
produce
everybody
stories.
to our,
you know?
Here we are in
So-
July 1st
Yeah.
press conference.
Even like when you're watching.
I am obviously remote today. I'd like to welcome Commissioner Brad Jackson, from Kosciuszko County Commissioner, Dr. Bill Remington from the County Health Department, and Ken Locke from the Salvation Army. I think we'll probably have a lot to talk about today, so let's get started. I think probably the first thing, you know, since our last press conference, I've kind of gotten a crash course in COVID symptoms and testing options, contact tracing, post-testing instructions. In fact, actually last Wednesday, I was involved in this press conference having just been tested that morning. But nonetheless, I'm feeling pretty good. Had a little fever to begin with. My energy's been down a little bit, but other than that, I feel blessed that I don't have some of the more symptoms that many people have been burdened by. I was told to quarantine for 10 days from the onset of my symptoms and not end that quarantine until I've had 3 consecutive days without fever. I'll add, my fever has been, I've had really no fever since my initial spike when this whole thing started. So, and the last thing about me, I don't want to make this about me. I do plan on seeking another test to confirm that I'm negative before I ease back into work. You know, I kind of joke a bit about this whole thing. That's how I deal with this. You know, I tell everybody I'm in the doghouse for another 3 days for quarantine, and it's just my way of dealing with it. But I just want to assure everybody through my experiences, you know, there's really nothing to joke about as this disease just doesn't seem to want to go away. So, you know, today the governor will probably address the move to phase 5 this Saturday. I know to the immediate north of us in Elkhart County, they're not ready for that. But if we do indeed go into phase 5, you know, we just still have to be very mindful of the potential for this thing getting out of hand as people let their guard down a little bit. So, you know, being involved from the positive side, I was really able to get a pretty good perspective of those that are needing testing in our community, you know, the feelings you have, you know, what do I do next, the concerns and anxieties of those going through testing, and then if positive, now what do I do? And even if negative, now what do I do? You know, it's a very important perspective I wish I didn't have to experience, but hopefully it'll help us improve our work as a community to try and keep everybody safe moving forward. So I thought maybe what I'd do is just pass along a few observations that I've had this past week. I think all pretty good. The first thing is obviously with our number of positive cases growing locally, testing locally has gotten very busy. I know I just got the numbers from Tina out at MedStat, and our city and county tests that we provided we're up to 235 tests. But I'm seeing that families wanting to get together for the holidays, you know, they feel the need to be safe and are getting tested. My advice would be if you feel you've been exposed in close contact or you feel you have symptoms, you should seek testing, and I would strongly advise registering online. The parking lots get pretty hot in this 90-degree heat, and if you do have symptoms, it's not going to help you at all. So please get online with any of the local testing sites and try and get pre-registered. That should help. Unfortunately, the results can take anywhere from an hour up to 5 days. My test took 5 days to get my results back. So there's a little bit of patience involved, but getting the test is so critical, and getting it done, trying to minimize, your issues getting it done. In other words, trying to be as efficient as you can by pre-registering, I think, is important. Second thing I wanted to talk about, Indiana State Department of Health. I know we've talked about the contact tracing program that they started several weeks ago. I've got to say, I was actually contacted by the Indiana State Department of Health the day before my test results were actually given to me. So I knew when I got a text message from the Indiana State Department of Health that the lab had probably provided my results to them. But nonetheless, it was a very prompt call. I had a gal who spent a half an hour with me talking about the importance of the contact tracing, identifying the others at risk. She asked me several times if there was things I needed to stay quarantined, if there were food needs that I had, if I didn't feel safe where I was, if others didn't feel safe. I mean, she was very compassionate. I think they were trained well, and they got the information out to me in a very, very efficient manner. And again, I think that the call was very prompt. Then those that were identified as potentially being close contact did receive follow-up calls within 24 hours. And a lot of it might have been a text message, but nonetheless, my experience with the State Department of Health contact tracing protocol was very, very positive, and I think they're doing a great job, not only identifying those at risk, but also educating folks immediately of the most critical and up-to-date information from State Department of Health and the CDC. So that was a real plus. Unfortunately, experiencing that, but nonetheless, I did get a great insight into that. I think what I've kind of learned through this whole thing is that testing is so important to combating the spread, because at the end of the day, anybody testing positive is going to be isolated and contact traced. And those are the two things that are just absolutely critical to controlling the spread in the state. I know the governor's predicated a lot of his reopening based on improving our testing and improving the contact tracing. And, again, the isolation that is required when someone tests positive, again, through state CDC protocols for isolation and quarantine, those are right up front. They're given to you. You know what they are. And by being tested and testing positive, you're given that information. A negative test will also give similar, more appropriate information for someone that feels they might have been exposed but did test negative. So the testing really much starts the process of that isolation. And obviously, as I've just discussed, the contact tracing is that detective work that identifies those at risk and trying to get a hold of them as quickly as possible for them to take appropriate action, be it testing, be it quarantining, whatever. So again, testing leads to the proper isolation protocols and the establishment of contact tracing that are just critical to us knocking this thing down in our state. So I'll switch a little bit to some of the work that we've been doing as a city and county and some of the updates there. We mounted a rather significant public education campaign to those at-risk populations in those neighborhoods over the last 3-4 weeks. We've obviously now provided testing for our residents, at no charge and regardless of their immigration status, which again is helping to improve the access to the testing. We're now looking at trying to improve the process of some of those testing options, some of the hiccups we've seen with the testing. We're possibly looking at a mobile site in the county. We're also looking to improve bilingual services to assist when test results need to be disseminated and follow-up instructions given. We've identified that that is a weakness, and we're working hopefully with some CARES Act funds to improve those services. But just a special thank you to the health department, certainly the county and our local health providers for all their collaboration to reacting as quickly as our tests and positive tests have gone up. Everyone has done a great job to try and keep us, improve the testing, improve education, and just keep this thing moving the way it should. I think the last thing that we have to talk about are face coverings. You know, obviously the virus is not going away. You know, we must all take individual responsibility to control the spread by wearing a mask in public when social distancing can't be controlled. You know, mandating masks is becoming more commonplace. I know up in Elkhart and St. Joe County, they're facing much more critical acceleration of tests, positive tests. But nonetheless, you know, hopefully we can learn by what they're doing to try and prevent this from happening down here in our county, even as we are looking at more and more tests. Some communities and states, you know, they require masks. Been in communities where essentially at the door of businesses it says no mask, no service. I personally feel like wearing a mask is the easiest and most effective tool that we can all individually do. And most importantly, you know, the use of a mask is protecting those around you. And I think that's really the way to look at it. You know, this is a very caring community. And I know no one would ever knowingly infect someone else. So it just, to me, it's really important to wear masks in the stores and the restaurants and at other times when you can't control, you know, your social distancing. You know, none of us are perfect. There's times we let our guard down, but I think getting in the habit is the best way to try and get beyond that. But I don't think anyone will argue that as we've learned going through this virus, that they've pretty much proven beyond a doubt that probably wearing a face covering is the most important thing you can do personally for yourself and those around you. So, you know, I still believe it's a matter of personal responsibility. I don't know that there's a way to you know, make sure that if we did create a mask order to enforce it, I just think people know how important it is and need to take that personal responsibility in light of you know, just as a personal responsibility and not creating a mask order at this time. I know as the schools are preparing their plans to open, and Dr. Hoffert will be at the press conference next week to discuss the specifics of school reopening. And I know other communities have already mentioned that masks will be required in schools. So, you know, that's still an element of you know, what's to come with masks in our community is coming to when school starts. I do want to tell you we've still got masks available at Station 1 and Station 2, so that's the downtown fire station and the East Center Street fire station. I know Chief Wilson and his guys have been delivering masks to areas that have requested them. I know Ann Sweet and her group are still providing masks, and every other group, and I don't want to slight others that are making masks. But those masks are being provided still to the fire stations, are still available at no charge to anybody that wants them. And I would ask you to please continue to take advantage of that. So I think that's it for me right now. I'm sure there'll be some questions, but I think it's appropriate now to turn the microphone over to Dr. Bill Remington from the Kosciuszko County Health Department to give us their update. Bill?
Sure, thanks, Mayor. So sorry you have the infection, and hope you continue to recover quickly. It was reassuring to not hear you cough or sound short of breath, so just as a clinician listening to you, I think you're on the right path here. It's interesting the insights you gain in this whole thing when you experience an infection, and our whole goal here is to try to minimize the infection impact in our community. Let me just give you the bird's eye view from the health department. Numerically, we continue to see a steady growth of cases. The last 5 weeks has really taken off for us. We continue to see a rather linear growth. We do not see explosive growth of cases. So if you look at our growth of case week by week, it has not gone through the roof. We counted 69 new cases of the previous week, 87 the week before, 91 the week before that, 86 the week before that. So you don't hear 50 cases one week, 100 cases the next, 200 the next, 300 the next. We do not, at least at this point, experience that explosive growth that they have in our neighboring counties, unfortunately. And just as the mayor said, we want to continue the drumbeat to be diligent with this respectable new virus. It's a real thing. Our growth of cases is not simply a growth of testing. The frontline service providers, whether it be hospitals in the region or urgent care centers, are seeing more ill people. It's been a little bit of a crush at the door, certainly in Elkhart County, not so much at our hospital here in this community, but still, volumes are up. So it's a real deal. It's not just a testing phenomenon. We continue to feel that our place as the health department is to increasingly be available for consultation, so the day is filled with being on the phone for our staff, handling lots of questions from constituency, whether it be just individuals or whether it be a employer or a nursing facility, and schools. That's certainly a big role for us. We are less involved with case contact work, although still engaged with that substantially. We get a lot of questions, and we have to roll up our sleeves and dig in. We feel, just like the mayor experienced, that the service contractor doing case contact investigation for the State Department of Health has really improved. They've worked out a lot of the bugs in the last month, and we're very thankful for that. We feel the appropriate messaging remains as we have. That is, masking is strongly encouraged, particularly when stepping indoors to a retail establishment or business or crowded environment. Wear a mask when in a crowded outdoor environment. I have personally wrestled quite a bit as I have listened to the discussion coming out of Elkhart County and St. Joe County as to whether or not we in this county whether I should personally push for a mask mandate in the county, and I'm not there yet. I hope we never have to. Our case volume per population in Kosciuszko County is less than half what it is in Elkhart County, just as one metric to follow. And as I've mentioned earlier, our weekly growth of cases has not been explosive. And those two metrics, I think, at least in my head, will have me continue to voice the voluntary nature of a mask recommendation. You do certainly open up a can of worms with a mask mandate. You get into enforcement issues, and in some settings you can really kind of lose your voice, if you will, in public health. In other places, it certainly can emphasize the importance of the pathogen and that we want to respect it. But it is a bit of a can of worms with a mandated mask policy. But we could go there. We will continue to watch these numbers. Before I would ever come to that decision as a health officer, I would have broad discussion with our elected officials. This would not be ever done in isolation. And my mindset is, again, of the temperament to continue a voluntary perspective on most of what we do. If numbers really do blow up, I'll just tell you that the mask mandate is in some ways your lowest hanging fruit to reach for. It does not have the economic impact of taking big backward steps with closures. So it's a tool in your toolbox that, as onerous as it may sound to many, is really low-hanging fruit and is less the evil than some other things you could choose to do. The economic side of this whole pandemic is very, very respectable. People need jobs. They need to be able to go to jobs, and that's been discussed at this dais several times, and I continue to feel that way. So we'll continue to watch these numbers carefully. Our neighboring counties' experience is certainly respectable. We have a respectable presence in the state of Indiana as far as growth of numbers right now. I looked at national numbers just last evening. There's just a little bit of a J-hook on the end of the downward trend of national numbers from the last week or two. So as you've been probably hearing on national news media, there are other places blowing up, not just District 2 of Indiana. And it's starting to show itself a little bit in some of the graphics coming from the CDC with national data. So this virus continues to be unpredictable. It's going to be here for a while, I think, and mar our life to some degree. Schools will be a big deal, and how to get them back safely. Public health thinkers continue to voice the importance of getting students back to school. I hear that strongly coming out of the voices from Indianapolis, so we will play to that theme. And the State Board of Health has provided more resources for the schools. They're starting tomorrow with a weekly webinar with local health departments and school nurses. They have hired a school nurse liaison. So they have helped ramp up some resources for our schools as they engage with students here in just a few weeks. If I could jump back to the COVID testing, there are a couple other opportunities. We have robust opportunities for testing here in the county. As the mayor mentioned, the queues are building a bit. So if you seek testing, try to register online. The State Department of Health, with the Elkhart County experience, has created 2 new drive-through testing sites for Hoosiers. One is in Goshen and one is in Elkhart, and those can be found on the COVID website for the State Department of Health. That's another opportunity for residents in this county at no charge. So I wish this had been gone by now. Wish we had completed the ball game. The 9th inning was over and we're done, but it's not that way. I'm sorry about that. Wish I could control that perfectly. We at the health department feel very committed with this, and we want to take the right steps for our community to mitigate as much injury as we can. Thank you.
You still there, Mayor?
Yeah, sorry, I was muted. The usual pop off on Zoom. No, wanted to turn it now. Thank you, Dr. Remington. Turn it over to you, Brad, to give the county perspective.
Okay, I think you and Dr. Remington have covered 99.9% of it, but just a couple of things. We're still spraying and disinfecting every day at the county. We're still obviously have the, which we will, I'm sure, well in the future, if not forever, the sneeze shields or whatever you like to call them up. We still have the, like you have at a movie theater, crowd control things, I guess, line savers, where we're using those to help maintain social distancing. Thankfully, so far, we still only have 1 team member that's officially tested positive, which is, I think, pretty remarkable. And we're very thankful for that. You'd mentioned a little bit about the CARES Act dollars. We are using those to help offset some of these expenses that we have, you know, with all the things I just mentioned are obviously costs associated with that. So we're thankful for that. And then you'd mentioned too that between the city and county, I feel there's been a great partnership between us, and especially with the testing. I think that was something that's really important to make sure that everybody who needs to get tested is able to do it. There's not a financial barrier preventing them from doing that. So I think that's about it. You guys did a good job covering everything.
All right, Brad, well thank you. I certainly appreciate the participation of the county in our press conferences and all the collaborative work we've done, and unfortunately our work isn't done, but again, thank you for your diligence and all the help. Ken Locke has been working with local organizations and those that have been impacted in very basic ways in our community from the negative effects of the COVID virus. Ken probably doesn't like to stand up and talk too much in front of a microphone. He prefers to lead by example, and we're certainly thankful that our community has Ken and all that he's able to do, and not just his organization, but his ability to rally all the organizations together. It's really given us a great advantage as we've tried to meet the needs of everyone's issues in our community. So Ken, you've got the microphone, and certainly would like to hear some of your challenges and hopefully a few success stories and any requests you have.
Thank you, Mr. Mayor. There's kind of there's a theme here that I think is really important. I was thinking back to when we first really got into this in March, and maybe a little bit earlier than that too. But collaboration is really the name of the game. From the outset, we all came together as much as possible through social service agencies and churches, and are doing the best we can to work together. No one group can take this on. It's our health, it's our government, it's our private agencies, it's our churches. We all need to work on this together. And I think to Kosciuszko County's credit, and I always ascribe to my home state of Iowa that I was born in, but I'm much more probably I'm not a Hoosier. I can never say that, but I'm definitely a citizen of Kosciuszko County, and it always amazes me how we come together. And from the outset, Combined Community Services, Fellowship Missions, Kosciuszko Senior Services, the Food Bank of Northern Indiana, and I don't want to, when I start listing those, I almost hesitate because I don't want to leave anybody out. But we all came together and said, what can we do to best serve the people? And so we developed plans. We all learned how to maneuver Zoom, which was interesting at first. I wish we had, I don't know if we recorded any of those first Zoom meetings, but it'd be rather interesting. And we somehow have survived that too. But we have sat down, and the good that will come out of this, anytime you have a challenge, good will come out of it. The good that will come out of this is that I hope that we can continue that spirit of collaboration, which has always kind of been there, but we really fine-tuned it here recently. And with the Salvation Army, we're obviously we're an international relief organization, so we're dealing with this on a worldwide situation, and obviously in this country we're dealing with it a lot. But what they are telling us from our standpoint is they keep telling us to look at this as a long-term situation that we have to address, that there's not going to be any silver bullet, there's not going to be any magic potion necessarily. Maybe there will be, but we don't know that. But what they're saying is the long-term effect of this is how we're going to be needing to respond to this. We don't know a few months down the line, especially if we have families who are not getting back to work, who are not, those kind of things. We're starting to see that a little bit. We haven't seen a lot of that yet because there's still a lot of, unemployment and stuff, and everything is pretty much in place. But if we get beyond that barrier, it could get, and that's what they're telling us to kind of prepare for, and that's what we're kind of saying to each other in our meetings as well. We primarily have focused on food, rent, and utility assistance are the three that we've been looking at. There's been a lot of funding out there. And so part of that is just maneuvering through, trying not to duplicate what we're doing. So we've been working on systems of not duplicating our services and trying to stretch resources as far as possible. But those numbers have not been dramatic, but at the same time, they're starting to begin to go up a little bit now, especially as we're seeing people not getting back to work. The one thing I thought that was really important to say here is we have to be really sensitive to the fact that people have been isolated. There's a tendency for people to be lonely. Even there were a couple of times there in April where I was just like, we never closed our office, we just changed our systems, and so I was going into work every day. But even sometimes, there was just this sense of just feeling a little bit isolated. And when you go into a meeting, you know, people are wearing masks. And I've gone into a couple places where I've been wearing a mask. I never thought I would wear a mask. I went into the bank the other day wearing a mask. Never thought I would do that. And it's changed some of our dynamic with one another, but that tends to then eat at us on the inside. And particularly what we need to be really sensitive to the elderly in our county, because many of them are already isolated, but this will tend to push it even further. So what I would say to people is, if you have somebody elderly, maybe I'm talking about the elderly because I'm a little closer to that than I used to be, but if you have somebody in your neighborhood, make sure you're checking up on them. And if you're uncomfortable in doing that, call one of the agencies, call the Salvation Army CCS, call one of us, and we'll certainly go out and check on them, because we don't want somebody left isolated. Get on the phone and talk to them. Some of these folks don't know how to maneuver social media, okay? But call them on the phone. But I think we've got to really be sensitive to that, because a lot of the calls that we get into our office are from elderly, and they just want to talk to somebody. And I've told my staff, I said, if you have to be on the phone with them for 20 minutes, be on the phone with them for 20 minutes. I said, take time to talk to them, let them talk to you as well. And I think that's something that we really need to continue to focus on. The food situation the response of food has been amazing. The school system has done an awesome job in getting food out to students and to families that way. We're getting food out to families as well. Through the food bank, we've been able to do extra food boxes. So that situation is, I think we have a really good handle on getting food out to families, and that's really worked out well. And we're gonna continue that. We'll be announcing some more dates here down the line to help in that as well. But the interesting thing, even in the food giveaway and watching the people coming through the line, it's primarily been elderly coming through the line, because I think they just want to get out, they want to see a face, they want to talk to somebody. So we need to really stay focused on that. I guess the only other thing that I really had to share, and this is more from my Greater Ministerial Warsaw hat, is we're really starting to encourage and saying to churches that we want to do as much as we can to let our law enforcement, fire, and those personnel know that we support them, and we want them to know that we appreciate what they do. Back when I was in the U.S. Army, we didn't ride. We were past horses then. We weren't, at least we weren't riding on horses, but. We had, and I see Brad's wearing an analog watch. But we used to say to each other as we were training, "I got your six." And so what we're telling to people is, we want our corrections personnel, our dispatchers, our fire, our law enforcement, and our military National Guard to know that we've got your six, that we appreciate what you're doing. It's been a tough time. It's been a tough time for some of these. And the media, thank God, not on a local level, but on the national level, many of these different groups are getting hit really hard. And the emotional and things that are happening to them, right now, we need to be cognizant of too, that we need to be supporting them and doing everything we can in that area too. So we're going to be talking about that. although I understand, we get calls all the time, should I take cookies over to the fire department? Should I take food over to the fire department? And I get calls from the fire department saying, please don't send anybody else over here with cookies and food, because we don't need, we don't need it. We don't need them to get any, we need them to be healthy. So that's not what we're talking about. We're talking about, to support them, to pray for them, and let them know that we appreciate what they're doing, because it's a tough job. I've ridden along with a couple of them in my life, and I thought there's one job I'm never going to do, and that's one of them. So we need to support them as well. But that's pretty much all I have too. So, but thank you, Kosciuszko County, for coming together. You never cease to amaze me.
I would agree with that.
Thank you, Ken. I appreciate that, and I would now open it for questions. With me not being able to see who's there, if you would at least identify yourself when you ask a question, that would be helpful. All right.
Dan Spalding here. I have a question for Dr. Remington and Mayor Tomer and Brad Jensen. What do you want to see the governor do today? Would you like to see him hold off on moving it to phase 5?
I'll go ahead, Brad.
That was Bill.
Go ahead, Bill.
Yeah, part of me would greatly appreciate that. I am increasingly mindful of large collective gatherings that will emerge this 4th of July. It'd be nigh on impossible for us locally to make a decision like that here at the last minute. A governor's authoritative approach, at least would take, for me as a health officer, take some weight off my shoulders a little bit with that. I think this holiday is particularly challenging with this, though. I mean, it's Independence Day. And that's huge for us. It's so ingrained in how we think as Americans. And I would never, ever want to tromp on the tremendous sacrifices that have been made to get us there with the level of independence we enjoy, even a public health threat. I think people really need to use their head this holiday, as I've mentioned earlier. Mask liberally, space yourself apart, just keep your head on and deciding which gatherings to go to, particularly if you have compromising chronic health conditions or advanced age. Be very mindful. But yeah, part of me would appreciate a move like that.
Yeah, I can't say that I could speak it any better than what Dr. Remington has just said. I would certainly hope that the governor is looking at all the numbers and from a statewide view and makes his decision based on that, knowing that we are adjacent to a significant hot spot. I do appreciate the fact that there is some discretion into what each county can do, and as we've discussed earlier, be it with a mask order or rolling back some of the openings that we've already done, those are things that can be decided as we need to, as the numbers dictate it. So I do think the governor has given us the opportunity to be a little bit more restrictive if we feel we need to. I like Dr. Remington, have always talked about the difficulty controlling large outdoor social gatherings that really have no ability to control that social distancing, and that again is my concern. Again, going back to what I said initially, I think there's such a personal responsibility. It's hard sometimes to say no to an event when probably should, and just to protect yourself and your family. I still like the idea of hunkering down with your family over the holidays and trying to minimize that interaction. But again, we're a little conflicted here in Indiana. We're somewhat flat. I think we've been doing a good job, but I think the potential for an increase is just lurking around the corner. And no matter what the governor says, we've got to continue to keep our heads down and try and make good personal decisions.
I don't think there's a whole lot to add to that, and I agree especially with what Dr. Remington said, and the fact that, I've said this before, the state has access to, way more people than we do at a local level, and facts and figures and matrix and stuff to make good decisions. So I think rather than me sit here and be an armchair quarterback and suggest, I'll yield to his wisdom and information he has, he being Governor Holcomb.
All right, next.
I have a sort of a science question for Dr. Remington.
This is David Sloan, by the way.
Yeah, thank you.
Got your back, Dave. Got your 6.
Anyway, everyone knows that the mayor has been wearing his mask faithfully, seen out everywhere. But after it came out that he was tested positive, people were questioning the science behind the masks and how if they wear one, it would help them or help others. And I tried to explain it, but not very well. I'm not much of a science guy. Could you go into more of the science of face mask wearing and how that helps?
So there's, there's been such a dynamic element to the science of what we understand with this new virus all along. The respiratory spread is certainly the big piece with the contagious nature of this virus. If you just do this, take a big step back and look at where we've come since late January around the globe. This new pathogen swept around the globe and has swamped community healthcare settings, numerous places. And it did it quickly. So how do you do that? How do you do that? It can't be purely contact spread, to do that, in my opinion. There has to be a large respiratory component. The thing has to hang in the air longer than what you had first realized. And there has to be asymptomatic spread. That is, people spreading the virus unbeknownst to them, not ill. What you see when you take that giant step back is that footprint. And that's what science increasingly is identifying. So masks help reduce the respiratory spread. The more thorough the masking, the better. So in an ICU setting where my daughter is helping intubate a patient with COVID, they're really suited up. But out in the community, stepping into a retail store, a simple cloth mask is better than nothing. And you're doing it mostly to protect others, really. In case you are inadvertently spreading viral droplets out of your airway as you talk or shout at your kids, it reduces the spread. There is a little protection for you as well, depending on how good your mask is, as far as whether or not you can inhale the invisible pathogen that might be hanging in the air. Hand sanitation is important because what hangs in the air eventually drops out and lands on surfaces, and we, of course, touch those surfaces, and being human, we'll scratch our nose and touch around our mouth, and we pick up the virus too. So masking is very important. Good hand hygiene is important. Social distancing is important for a pathogen that has proven itself very efficient at silent spread. Whether masking should be mandated would be a great debate. Science takes you only so far with that discussion, really. Has a lot of social facets to that discussion.
All right.
Mayor, it's Nick Durant. I was wondering if you could kind of talk about your perspective on the virus now that you have been affected personally. Has it changed, your thought about it? Has it changed, how you've seen it in the past compared to now that you've had to experience it? Just what kind of new perspective has it given you?
Well, certainly a perspective I didn't want, but nonetheless, wearing a mask and doing all the things we've talked about, I'm not perfect. I don't wear that mask 100% of the time, and as Dr. Remington has stated, the virus is very opportunistic, and just that, I suppose, is probably the biggest thing I've gathered, not being perfect with the mask wearing. I try and set the example. I try and do it when it's important and when I feel that I'm putting myself or others at risk, but, that doesn't happen all the time. I wish I was perfect. I think that everybody struggles with that mask. It's you feel like we're opening up. There's larger gatherings allowed. There are bars and restaurants opening, and folks feel like, now that we're opening up, we're opening up back to normal, and we have to remind ourselves that even if we open up again this Saturday, this virus is still there. It's still lurking, and it's very opportunistic. And I guess my feeling is it just takes one slip up, and that the potential is there. So, the other part of that is just looking at what people face as far as having to get testing done, the uncertainties of what that means, be it positive or negative, how you've got to get the testing done, you've got to go through the contact tracing, the quarantining. I guess I just was learning by experience, unfortunately, what people go through, and I will say again, I've been fortunate. I've still got a few days left of quarantine, but I've been fortunate that my symptoms have been pretty minimal, and really without much of a fever, other than when I first was diagnosed. So I don't know. It's just a perspective. I've tried to look at holes in all the arguments, if you will, based on my experience, and I'm going to tell you, it's just bolstered to me what we've been saying, what the more importantly, what the epidemiologists and health department officials are saying about the disease. It's critical that we take it seriously and that we do what we're supposed to do as much as we can, as humanly possible. But seeing the other side of it, trying to get this economy opened back up and getting back to normal, that's the push-pull of this whole thing, and that obviously continues. I don't want to be sitting here isolated for 10 days. That's no fun. But, again, in light of my minimal symptoms, I'm certainly understanding how critical and important it is, no matter, where you stand. I don't want our community to get to the point where we're wrestling with numbers that now start to impact our healthcare delivery system, and we're definitely seeing that, 30 minutes from here to the north, and in other states in the country. It's states that you thought had gotten through all this, and bam, it's right back, and it's climbing again. So, we're kind of having gone through this, seeing the testing numbers go up, knowing what people go through. To me, Nick, to boil it down, it's a very, very, very real thing. I don't know what else to say.
David, for the time being again, you talk about people needing food. Have you seen donations to the Salvation Army to help others going down, or have other organizations seen donations go down outside the city?
No, the interesting thing is that, and part of this, it's just been interesting to me, that the requests haven't necessarily dramatically increased, but the donations have increased. And that's why, that's why I think for us to plan, right now for us to plan for the long term, it's kind of, you're kind of going, okay, well, we're kind of building up a storehouse, and I don't want to let people know we have a whole bunch of food and just come, which if they need it, we certainly want them to, but no, the donations have actually increased. Now, at some point that will tail off a little bit, as things kind of even out again, but no, the donations have been incredible, so.
Is there anything that you need going forward, other than food, or is?
We're always accepting food donations. Obviously, we're always accepting money. That's always a good thing. So, but whatever, I think the biggest thing right now is there are so many different pockets of money that are available for assistance that we're just trying to do what we can to stretch things as far as possible. I would say one of the challenges to some of the agencies, though, in moving forward is that there are certain types of fundraising that they have done that because of the restrictions that we have, it's going to be harder to do those types of fundraising, and some of them have had to cancel events. So that would be the downturn that we're seeing, and going forward, it's going to be interesting depending on how, especially if you have fundraising that's very socially oriented, depending like an annual dinner or whatever, those things, that's gonna, if we continue in that direction, that's gonna be tough for churches, agencies, whatever in that direction.
All right, anybody else?
Dan Spalding here. For Mayor Tolmer and Dr. Remington, it seems as if the federal government has no interest in further lockdowns or anything. They seem focused on reopening the economy. And if the governor doesn't slow down phase 5, then we're back to normal to a certain degree. So does that just leave it upon the personal individuals to try to slow this down at that point? Because there would be no other.
So I will take that first. As I mentioned, just because we're going to phase 5 doesn't mean that there's not still requirements that we, restrictions that we try and implement. We've all heard that this thing isn't going anywhere until we've got some type of vaccine, and some have even debated that. So, as we've all discussed, this is a new normal. We have to adjust to the way things are, and just because we're getting to the last stage, there's still that importance of restricting our risk that the governor it's inherent in what they're doing, and they're still following the numbers. They still have the chance to turn it back. I'm not trying to defend everybody going to stage 5 this weekend, because I know to the north they're not going to be going to stage 5 this weekend, no matter what the governor says. So it's just important to know that those are broad guidelines from, I think, a governor who's done a great job using the numbers, using the contact tracing, using the surveillance testing, using the county health departments to monitor local situations, and making decisions based on that in our state. I do have to believe, though, that in light of the increases in the majority of our states here in the last few weeks, they're certainly taking that into account. I'm not going to speak for the governor, but I do feel like that locally here, if we do go to stage 5, it doesn't mean Katie bar the door, we're back to normal. I don't think anybody that's been watching this whole thing thinks that. So.
If I could add just a comment, I mentioned weeks ago the conceptual notion of interdiction, that it's kind of a public health term of how you approach these things. And what you've been seeing for 3 months now is a horizontal interdiction. That is, you lay heavy ground fire, if you will. But that's not sustainable. It's just not. You run out of chips to play with after a while. Social will, the economy, we're seeing those things. So you eventually move to a vertical interdiction, more of a surgical approach to high-risk settings to mitigate risk. And it plays a lot to social, personal willingness for certain scenarios, too. So it's not that you're giving up. You're not. From a public health perspective, you're being more precise and surgical as best as you can. There is no risk in either model, of course. You are not taking the caseload to zero or anything near that. You are mitigating damage with a broad view of the damage of your mitigation techniques. And there's this tension in public health of how you dance through that and different opinions. So I have been a fan of that surgical interdiction mindset, which I think eventually you have to come to. You start to treat this more like a seasonal influenza, much more aggressive. I'm by no means saying it's the same virus. This is much, much more dangerous. But you got to get on with life to some degree. You got to find that happy medium. You need to protect nursing homes in this case, for sure. You don't let up on that for a long time. So a surgical interdiction. It was a nice, I think it was New York Times op-ed on that that was forwarded to me 3 months ago, I think it was. And that was well written, and I just love that thinking. And I think it's so true. I think we're at that point where we're seeing it bear out. You can only lay heavy ground fire for so long. You can always return to it if you must, if there's social will to engage with it, right? So interdiction and the types of broad philosophical techniques we have as we approach that in public health of some substantial discussion. So, but you're not giving up either way.
I have a quick clarification question. If the county decided to make masks mandatory, who would make that decision and how would it be made? Would that be from the health department or the commissioners? Or?
So that was my discussion with Mr. Weaver 2 hours ago this morning. We'll check into that. Apparently there's pretty broad powers as the health officer. I've never pulled that lever in the 25 plus years I've been doing this. I just don't think like that. So, but there are broad powers. I think you see that done in other places. I would engage leaders, elected officials. I mean, let's face it, I'm a bureaucrat. I'm not elected. So this has tremendous bearing on the population, and I think you engage with the elected officials as you make decisions like that. You bring them a good science piece, medical piece as best as you can. I've worked.
Yeah, I would just throw into that I know in certain communities the mayors can make a decision for their city, but I would never consider that without basically those sitting at the table, the commissioners, the health department, and myself agreeing if that's what needs to happen, and certainly taking the lead based on the data from the health department. I feel like it would be a collaborative decision as we work through this that way. To this point, I wouldn't see anybody going rogue and just saying, okay, this is what we're going to do. So
I think it's important to point out that the two, St. Joe County and Elkhart, excuse me, are both, they're an order, but there's no enforcement. So that's how I understood it. So you're not going to get like a ticket from the mask police or a fine or put in jail or anything like that. It's just, it's like a, yeah.
I don't know who it was in Michigan. Wasn't there someone getting fines like $50 first offense and $100 second? I don't know. I can't remember where I read that about. It was in Michigan. Maybe.
That could be, but what I read about the St. Joe and Elkhart is that they're a mandate, but they're a non-enforced mandate was my understanding of that.
That's what,
right.
I don't perfectly understand exactly that scenario, but I did watch over the last couple weeks just their thinking in Elkhart County, and I sensed the tough discussion about going to a mask mandate. I mean, they've had high numbers for a few weeks here, and just recently went that direction with a mandate. So that was very tough for them, very tough for them.
I know early on, I went to most of the larger retail stores and talked to their management about their corporate philosophies and corporate policies and procedures. And I know there's at least one large box store that requires a mask to get in to the store now. And I think that probably is that's been a very good thing. I would say that if individual retail decides that that's what they want to do for their employees and their patrons, that to me is a very good way to go. Again, and it seems to be pretty effective. I know at the one store you go in, if you don't have a mask, you don't come in, or you have to buy a mask. And I don't know how that plays throughout the community, but that is another way to approach this. Might ask businesses to consider those policies.
I think that's better for private industry to self-police themselves, because it's a free market. If people don't want to go in a store that doesn't require masks, then they have the freedom to not go in, and vice versa. If they, like Menards is, I think, who you're talking about, they mandate a mask, and that's their privilege. And if you don't like it, go to another store.
All right. Any final questions?
Getting some nods, no, Mayor.
All right, thank you. Thank you. Again, we'll be back next week. Dr. Hoffert, more than likely I'll be in my same chair here. So with that, we'll get a little bit different perspective for the next challenge, that being the reopening of schools. And Dr. Remington, I know you'll be able to help us with the State Department of Health and the State School Board, Department of Education, on what they're asking people to do and how that may play out locally. I know all the school corporations in the county are working very hard to come up with plans, and I think we'll get a pretty good glimpse into that next week. So again, thank you. Thanks, Ken, for your assistance and your work. Thanks for coming today. Brad, as usual, appreciate everything that's happening at the county and our ability to work together on this. And finally, of course, Dr. Remington, you're the best. I sure appreciate you and everything the health department does. So thank you all.
Thank you, Mayor.
Thank you, Mayor. Praying for a speedy recovery for you and complete. So
For sure.
I appreciate it. Like I said, I'm feeling pretty good. I'm starting to get a little feisty, so I think I got a few more days left, and then I will seek a negative test before I escape the doghouse here. So, but again, thank you all. Take care. Appreciate it.
Take care.
thanks.
Well said.